Hello and welcome back to the video series Awareness Campaign with the Maryland Healthcare Coalition Against Domestic Violence, centered on the intersections of health and intimate partner violence. I'm Lauren Doherty, the Training and Outreach Specialist with the Healthcare Coalition, and your host for the video series. Today I'm with Fashina Krokushenk, Women's and Maternal Child Health Consultant at Mid-Atlantic Permanente Medical Group and Steering Committee member with the Healthcare Coalition. Today, Fashina is going to be talking with us about how to screen for intimate partner violence. Fashina, maybe to get us started, you can discuss why it's important to screen for intimate partner violence.
Sure, Lauren. It is important to screen because screening is education. Even for victims who do not disclose violence, it is important that we screen because it plants the seed that IPV is a health issue and help is available. It improves the standards of care. Asking about intimate partner violence normalizes the issue and it helps remove the stigma around talking about it. Screening is important because intimate partner violence is one of the most preventable threats to women's health. Assessments is a requirement of the Joint Commissions and is recommended by many national organizations. Furthermore, victims of IPV are seen in the healthcare setting more often than seen in shelters or in the criminal justice systems combined. So we are coming in contact with these victims every single day and can help get them life-saving services.
Now that we've established the importance of it, how do you go about screening?
It's really important to be mindful of your body language, being engaged, having unintimidating body language, and screening with eye contact shows you care about your patient's safety, which is so important because many victims have been told nobody cares about them and nobody wants to help them. If your agency is engaged with screening for IPV, it is important to do so with every patient and to normalize the practice with your patient. You can say something like, because domestic violence is so prevalent in our community, I ask all my patients about it. You want to make sure and use gender neutral language. Start with using words like partner until the patient confirms boyfriend or girlfriend or the partner's name. Then you can mirror the term that they use.
And what sorts of screening questions can you ask?
There are a number of screening questions that can be used. One screening question that has been used in Maryland is, are you afraid of or are you being threatened by a current or former partner? Another is, within the past year, have you been hit, slapped, kicked, forced into sexual activity, strangled, choked, or otherwise physically hurt by a current or former partner? Regardless, it is important to list actual behaviors. If you ask, have you been abused without examples, many times people may minimize the abuse. And asking a question such as, are you safe when talking about intimate partner violence can be interpreted in so many ways. So it's important to be specific. If you are asking about sexual abuse, you may want to limit it to the past year. If not, the patient can tell you about childhood abuse, which then would be mandated to report.
Now, what do you do if you screen and the screen is negative, so the patient does not disclose that abuse is happening, but you still might suspect abuse?
That's a great question. If you suspect abuse, you can probe, but it is important not to force a disclosure, as this can ruin the rapport and sometimes ruin the chance of disclosure in the future. You can say something like, if abuse ever does become a problem for you or anybody you know, please feel free to talk with me about it, and I can provide you resources and it can be confidential. You can always ask, can I give you a few phone numbers just in case? Or you can say something as, I'm concerned about your safety. Would you please take some resources to go for someone else? Sometimes patients are reluctant to take resources for themselves, but may jump at the opportunity to take it for someone else. Then you want to make sure you document your findings in the patient's medical record.
Now, what if a screen is positive for intimate partner violence?
If a screen is positive for intimate partner violence or somebody discloses the abuse, it is important to acknowledge what the patient is reporting. You want to say something like, "Thank you for sharing," or "I'm glad you told me." You want to validate the patient's feelings and provide support by saying you're not alone and it's not your fault. Then you want to assess for safety. You can check in with the patient to see if they're currently feeling safe and is it safe for them to go home. You also want to refer to any resources. You can say, "I am concerned for your safety. Let me connect you with an expert." In a later video, we'll talk about the best ways to make these referrals. You might also want to make a follow-up appointment to check in with them at a later date if they're willing. And then again, you want to document this in the patient's medical record.
Well, thanks again for being here today, Fashina, and sharing such vital information with us. In the next video, we'll be discussing specifically about how healthcare professionals can document these interactions when they're encountering IPV. For those of you who are interested in learning more about screening specifically, or you would like to request a training or materials from us, please visit our website at www.healthandv.org.